Let's say we've got a 5-year-old
Okay.
that's got hay fever and asthma and itchy skin. What do you do at that time? Do you skin test at that age? Do you treat with different medicines? What do you do to help the family and the mother?
Okay, yeah, so the first thing, of course, is we always start with the history. Make sure we get a good history to get what the symptoms are, the pattern, the severity, and then we do the physical exam, and then we can do testing. So there's a couple forms of testing that we'll do. So for the asthma, for the breathing problems, we can do lung function testing when they turn 5. And the specific testing that we do, it's called spirometry. It's a way to assess their lung function. It gives us numbers to see if they're typical for asthma. And what we're looking for is we're looking for an obstructive pattern on their lung functions. If they have this obstructive pattern, that makes it definitive for asthma.
So there are certain numbers of the obstruction that makes the spirometry show that this is definitely asthma.
Correct.
So when that happens, when you make the definite diagnosis, you now know it, you take the spirometry for the viewers is when the doctor says, blah, 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 blah.
Right.
And so they're giving you a time over of 3 to 6 seconds.
Correct.
All right. So they've made the diagnosis. You then do skin testing to find out?
So, and the reason why we do skin testing is because 80% of patients with asthma also have allergic rhinitis. So you can't overlook the nose. We have to assess the nose as well.
If you leave the nose alone, if you just say, well, that's not as bad as the allergic lungs, then the lungs don't do as well?
Correct. So we aggressively have to treat the nose as well to get the patient to feel under good control.
So what's the treatment that you use for the 5-year-old that has abnormal spirometry and has hay fever? How do you treat those?
Okay, so there's going to be 2 medication options. The first medication is a controller or preventative medication, and this is typically an inhaled corticosteroid. Some common brand names are Arnudi, Flovent, Qvar, Asthmatics, and these are medicines that they have to take on a daily basis.
Why do they have to take them every day? What's it doing?
So what it does, it's a steroid that's delivered directly into the airways. And what it does is it decreases the inflammation or the swelling in the airway to remove the obstruction.
When the swelling goes away, then we breathe. But we've got to keep on it on a regular basis.
Correct.
Or what happens?
Then their symptoms will come back.
And the swelling comes back.
Correct.
So that's a controller. What's a reliever?
Yeah, so the reliever medicines are fast acting. They're rescue. I tell patients they're like fire extinguishers. They put out fires. And so the common one, the medicine is albuterol. The brand names are Proventil, Ventolin, ProAir. And these are quick acting inhalers. You can do 2 puffs every 4 hours as needed, and you should get relief within 15 minutes of using it.